Good morning.
Good morning.
I hope my voice is loud enough, but I'll take the mic out. Good morning, good morning. Again, my name is Eduardo Bareng. Am I loud enough for everybody?
Yeah.
All right. So, before I get started with the presentation, what I would like to do is just kind of give you a little idea of who I am, where I came from, and how I got to this point. So, back in 2009, my mother was actually diagnosed with breast cancer. And as some of you guys may know, when somebody gets diagnosed with breast cancer, it's not just the person that gets diagnosed, right? It's everybody. It's the entire family. It's their entire circle of influence and the people that love and care about those folks. So in 2009, when that happened, obviously that was very devastating news for my mom, for me, and I think the hardest part for me was looking at my mother that I care about so much and knowing that she actually had to walk this journey on her own. There's really nothing that I could actually do for her. I could walk alongside her, I could give her love, I can care for her, I took her to appointments. But at the end of the day, my mom actually had to fight this fight on her own. And there was a point after she was diagnosed and kind of going through some doctor treatments and visiting with the doctors, where she actually asked me, she says, hey, I'm going through a lot of stuff right now. I can't think clearly. There's just too much going on. Can you help me with some of this insurance stuff? And at that time I said, absolutely, anything I can do for you, I'm going to do for you. On top of taking you to the doctor's office, on top of anything I can do for you, I can do for you. So as I started reading through a lot of this literature, I realized there's a whole lot of legal jargon in this Medicare and insurance stuff. This is just so much information. They try to inundate you with all this information, and in reality, you only need about 20% of the information that they're shoving to you. So as I started looking at the information and reading over the information, my feeling to myself was, man, I feel like I need a doctorate degree just to understand half this stuff. But as I started digging in, I started talking, I started making phone calls. I literally made over 200 phone calls to folks that just trying to grab information. How does this work? What does this mean? And at the end of the day, what does it mean for my mom? She's not going to use all of it, but I need to make sure that the stuff that she is going to use is actually in the plan that we're going to choose. So going through all that information, I told myself that there's obviously a lot of folks out here that are going through the same situation. Maybe not cancer like my mom did, but other situations where they need the health care and they need to know what is important for them. How do we simplify it? So, me being in the community, I understood one thing, that we really need to simplify the information. It's about simplifying the information and extracting the pieces that really mean for the individual. And that's what I really did in the community for so long, is I simplified information and what it means to each individual. Because the little bit of information that you need can make a huge difference in your life and your lifestyle. It can really influence your life and your lifestyle. So that's when I actually decided to say, hey, let me get my license and let me help the community in this fashion. Let me help. There's a need for an advocate out there. And my hope for you today, and as long as you guys know me, is that I want to be your advocate. I want to be here to help you simplify the information and tell you exactly what it means to you. So, as I was going through that in 2009, not only was my mom kind of going through the treatment, but it was also my first year of marriage. So, obviously, going through that is a lot of sacrifice. I'm very thankful that my wife was very caring and generous enough to say, hey, I know the stuff that you're going through right now with your mom. Help her. Our plan together was always to help our parents. And I'm just so thankful for my wife to in 2009, our first year of marriage, saying, going through this particular situation, but we did it together. She helped me along with it as well, and I'm deeply thankful for my wife being with me during that time. I'm happy to say that my mom is cancer-free. She's gone through her treatments. It was stage 4, by the way. Stage 4 cancer when she was diagnosed. So, when you hear things like that, you're kind of like, wow, this is pretty intense. And we just didn't know what road we were actually going to take. So, again, I'm deeply thankful. But let's get down to business, okay? I know you guys are here for some Medicare information. There's actually a workbook in front of you. The workbook in front of you is pretty much the presentation, okay? There's some pens in your grocery basket, so you can pull the pen out if you don't have anything to write with. Now, the information I'm going to cover today is an education about Medicare, okay? Per CMS guidelines, I cannot talk plan specific, okay? If you guys have questions and they are plan specific, I'm gonna say, hey, we need to reset, ask for permission from CMS to be able to engage so I can talk to you about the plan information that you are specifically talking about, okay? If you have general questions about Medicare and how it operates, I'm happy to answer that. Also, at the end, if you guys have questions in the middle of the presentation, just write them down. I promise you I will stay here until all your questions are answered, okay? Compliantly. And I will be here. Just write them down. As we go through the presentation, some of the questions that you have, I may answer in the presentation, okay? So again, I appreciate everybody being here this morning. This is definitely precious time, and I want to make sure that I give you as much value as possible. So let's actually get down to business. This is our workshop. This is about Medicare and the basics of Medicare. Okay, a little bit of technical issues here. Let's find out what's going on. All right. Does everybody know what this is? It is the Medicare Card. It's the new revised Medicare Card. I'm actually happy they put it this way. For some of you guys that's had your Medicare before this last year, they actually had your Social Security number on here, or somebody's Social Security on here. So I am happy they actually took that off. There is a new number. It's a combination between numbers and letters. That's your identification code, okay? This is how they monitor your usage of the Medicare benefits. There are two important dates on here. The first important date is Medicare Part A. That's your hospital. That's indicating the month that it starts, okay? Medicare Part B, the month that it starts. In some cases, you will have that date the same day. In some cases, those dates are separated, depends on your work situation, okay? So, this is what the new card looks like. All right, so eligibility. To get eligible, you pay into Social Security for 40 quarters. That's approximately 10 years, okay? Now, there's other ways to qualify for that, like you have a spouse that qualifies for 10 years or 40 quarters. Other scenarios might be like disability, end-stage renal disease, or some type of disability that happened. Or you can purchase it. There's some folks that come that haven't worked the 10 years, they don't qualify. You can purchase Medicare. Okay? All right, so the 4 parts of Medicare are 4 parts of Medicare. Part A, this is your hospital. Okay? Now, what does that mean? Again, I'm going to simplify this, okay? When they talk about hospital, they really talk about it like a hotel room. When you go to the hotel room, it's your bed, it's a little bit of room service, and then they might give you a continental breakfast, right? Okay, that's pretty much how Part A works. Now, there's a little bit more entail to that, but the basic of it is it's a hotel room. That's what you're paying for when you pay when Part A is in effect and you're using your Part A. It's a hotel room. So when you go to the hospital and a doctor comes and sees you, that doctor's not covered under Part A. It's just the room, it's just the bed, it's just the food that they're feeding you. Part B. Now Part B, this is the medical piece. This is your doctor visits. This is your durable medical equipment. These are the nurses that come and visit you and give you the different prescription drugs that they administer to you. Okay, that's what this Part B is. That's everything else. So Part A is the hospital stay, your hotel stay. Part B is pretty much everything else. Part C is the Medicare Advantage. So Medicare Advantage plans is your Part C. So Part C, Medicare Advantage, you'll hear both of those terms, but they're the same thing. Okay? Part D is the newest part of Medicare. This is your prescription drug plan. D for drugs. Okay? So this will cover your drug plan. Now, as we go through this, you'll see that your Part C sometimes has that drug plan built in. There's really 4 ways to set up your Medicare. I'll mention the first one that I'm not really going to talk about today, but that would be your group coverage or your retirement coverage paired up with Medicare. Okay, so that's one way that it could be set up. Okay, the other 3 ways that we're going to talk about today is original Medicare paired up with your drug plan. Okay, that's one way to set it up. The second way to set it up is your Medicare paired up with a supplement plan and a drug plan. That's the second way to set it up. The third way to set it up is your original Medicare and allow your Part C or your Medicare Advantage to manage the entire deal. Okay? So those are the 3 options that we're actually going to be talking about today on how to work your Medicare. But first things first is we're going to cover what Medicare covers and how it operates. Okay? Go to the next slide. Okay, so Part A, again, 40 quarters, 10 years. Okay? If you get 40 quarters, 10 years, your monthly premium for Part A is 0. It can be purchased up to $437. Okay, there is a tier system for how many hours or how many years you work or how many quarters you work. There's a tier system. But the top end of it for Part A only is $437. Now this covers, again, the hospital service, 70 private rooms, your meals, general nursing, drugs, when the nurses are administering it, okay? Some hospital supplies like your bed sheets, your pillows, different things like that, okay? It also includes acute care, critical access, inpatient rehab, and long-term acute care, along with mental health. Okay? So that's kind of the breakdown of your Part A. Also includes some skilled nursing, hospice, home health services, and your first 3 pints of blood. Okay? So that's exactly what Part A covers. That's how you get it for premium free. Anything below 40 quarters or 10 years, there's going to be a scale up to $437. Okay? This is the rest of Part A. This is the actual financial pieces of Part A. Okay? So we know that it could be 0 premium or up to $437 a month. Okay? But this is how it works. Days 1 through 60. There's a deductible of $1,364. $1,364. Now what does that mean? It means if you spend 1 day in the hospital or 60 days in the hospital, your deductible will be $1,364. Okay? Doesn't matter if it's 1 day or 60 days. That's your deductible. That's what they're going to charge you. Days 61 through 90. $341, and that's per day. Okay? $341 per day in between the days of 61 and 90. Now, days 91 through 150. Okay? These days are very important. These are what you call your lifetime reserve days. What does lifetime reserve days mean? It means you can only use these days 1 time. Okay? So if you go into the hospital 92 days, you've used 2 days of your lifetime reserve days. You only have a total of 60 days. Okay? Days 91 through 150. Okay? So every time you get past 90 days, you start knocking on those lifetime reserve days. You start taking them off of the books. Okay? Once you use all your 60 days, you're responsible for 100% of the bill. Okay? And again, this is just Part A. Just Part A. These are your payments and co-payments and co-insurances that apply when you're in the hospital for Part A. Okay? Part B. Okay? Again, Part B is the medical piece. Okay? This is your health insurance, and this is what it covers. So it covers that doctor visits, like I was saying. The lab tests, surgeries, durable medical equipment, ambulance services, immunization shots, and prescriptions, outpatient prescriptions. Now that's obviously not a complete list, but again, it's everything outside of the hospital. Now there is a tiered structure when you're working with the premiums. When you get into Medicare today, it's $135.50. Okay. It can be higher. It can go up. The reason why it goes up is based on income. Okay? So if your income is at a certain level, that $135 could go up. Okay? Now there's also a deductible on this plan. It's $185. Okay? So the deductible, just kind of explain the deductible. I'm sure most folks know what deductible is, but that is the financial responsibility that you're responsible for before the plan does anything. Okay? So before Medicare does anything on Part B, the deductible needs to be paid first. Okay? So, go back just a little bit.
Is that one time? One time per visit?
One time per year.
One time per year.
Yes, the $185 is one time per year. Okay? Once calendar year, January to December. Yes, ma'am. Now, once you pay the $185, Medicare Part B turns into an 80-20 plan. Medicare picks up 80%, okay? Medicare picks up 80% of the tab. However, you are left with the 20% uncapped. Now what does that mean, uncapped? It means that there's no ceiling. That 20% could be quite a bit, okay? There is an example that I am going to show you on what I mean by uncapped 20%. Okay, but let me go ahead and finish up with Part B. So Part D, the newest part of Medicare, it became into law in 2006. Part D is recommended. They're not going to force you to get it. Okay? However, if you are eligible for Part D and you do not elect to get it and you do not have a credible drug coverage, when you do get your Part D, they will penalize you. Okay? And that penalty will last as long as you keep your Part D plan. Okay? So it's a lifetime if you keep your drug plan for a lifetime. So that penalty will be assessed as long as you keep Part D. The penalty on it is 1% per month that you could have had it. Okay? So Part D covers prescription drugs, even through Medicare. Part D is highly regulated. They are administered by private insurance companies. Okay? So they're not administered by Medicare, they're by private insurance companies. Okay? Now they do have contracts with Medicare. So Medicare understands exactly what they're doing, how they're operating it. They do have a contract with Medicare on that, okay? So this is the example. Now, this example, I'm going to give you just a quick story on why this example really means something to me. So a year ago, I had two uncles, Uncle Willie and my Uncle Al. Both these folks, one had a stroke, one had a heart attack. My Uncle Al started having chest pains. He was like, hey, I just need to go outside and get some fresh air. He jumped in his truck and took a drive. And he was found about a mile away from the hospital. It looked like he was trying to get to the hospital. But he died in his truck on the way to the hospital. Heart attack. Okay? The statistics on these things are real. My Uncle Willie, me and my family, he's my uncle, he's my neighbor, he's one of my best friends. We seen him on a Saturday. My kids ran up to him, up to the truck, hey Uncle Willie, gave him a big hug. He always gave him a lollipop. They come back with a lollipop and start getting sugared up and start running around. He went to his home, and Monday we found him. He had a stroke in his home. So these statistics are real, okay? And I lost two very close family members in 1 year. So I know that these things really, really happen. So in this particular example, this person had a quadruple bypass surgery with complications, okay? Quadruple bypass surgery with complications. 150 days in the hospital. That's what, in this example, this person stayed 150 days in the hospital. This means that they used all of their lifetime reserve days, okay? And the reason why I did that in this particular example is because I want to show you the money that's spent, okay? So 150 days in the hospital comes up to $93,434. Okay, that's that $1,364. That's that per day, all the way up to 150 days. $93,434. That is your responsibility if you have Medicare. The physician services for the quadruple bypass surgery, $400,000. Now Medicare picks up 80%. Picks up 80%. It leaves you with $80,000. That would be your responsibility if you have Medicare A and B, and a drug plan. Okay? So this is if you have Medicare, A and B plus a drug plan. So $93,000 plus $80,000, and you have your Part B deductible of $185. Okay? So $93,000, $80,000, $185. Your responsibility is $173,000 and 619 bucks. $173,000. That's a house. Okay? For this 150 days in the hospital for this particular surgery. That's what I'm talking about when I say uncapped 20%. That 20%, it could be much higher than that as well. If this person stayed longer in the hospital, if they had to go back into surgery, that number can actually be much, much higher. Okay? But in this particular example, $173,000 is what was spent. Okay? I want to talk a little bit about the penalties. Okay? The penalties. There is a 7-month enrollment window when you're aging into Medicare. Okay? It's not 7 months from your birthday. The way it works is 3 months before your birthday, the month of your birthday, and 3 months after your birth month. Okay? That is your 7-month window. So as you age into Medicare, you can actually enroll into Medicare 3 months before your birth month. Okay? Now, if you miss this particular enrollment period, they assess a penalty. That's why it's so critical to understand how this enrollment period works. Okay? The penalty is 10% per year that you could have had your Part B of Medicare. Okay? So 10% per year. The same applies for Part D, which is the drug plan. Okay? Now the drug plan, same enrollment window. 3 months before, the month of, and 3 months after your birth month is your enrollment period. If you happen to miss it, their penalty is 1% per month that you could have had. Okay, so one is 10% per year, the other one is 1% per month. And that's going to be dictated by the national average. Right now, the national average for a drug plan is $38. Okay? But when you enroll, if you enroll late, you're subject to whatever the national average is. Right now, it's $38. If it goes up to 50, it's going to be 1% of 50 bucks. If it went up to 100 bucks, God forbid it doesn't, but if it went up to $100, it would be 1% of $100. Right now, the national average is $38. Okay? So I'll give you a quick example for the Part D penalty. National average $38. You multiply that by 1% over the 12 months, you're looking at an additional $4.56 on top of your monthly premium. Okay? For the Part B, multiply that by your 10% for just 1 year is $13.55, which means you would be paying $147.40 because you were late by 1 year. Okay. That's how your penalties work. All right, so your enrollment dates, we were already talking about it. 3 months prior to your birthday. Now, you're not automatically enrolled into Medicare. Okay? Now, if you are collecting Social Security before you age into Medicare, you will be automatically enrolled. Okay? But if you're not collecting Social Security when you're aging into Medicare, you need to apply. Now, there are different deals. If you are working and you're aging into Medicare and you're going to continue to have your group coverage, number one, you need to make sure that your group coverage is credible. Okay? Credible pretty much means it needs to be equal to or greater than what Medicare offers. Okay? So that's the group coverage. So if your birthday was April 15, 1954, your effective date, Medicare will start April 1st. Now you can start the process again 3 months before your birthday or your birth month, but it won't start until the 1st of April in this particular example. You have up to 3 months after. Now, whatever month that you enroll in, it'll be effective the first month, the month after. Okay, so if in this particular example, if I enrolled into Medicare in May, my plan will not go into effect until June. Okay, so it's the month after that it goes into effect. Okay. Medicare supplements. That uncapped 20% that we were talking about. That uncapped 20%. This is how you can cover some of that 20%. This is one of the options. Okay, so the first example that I showed you was A and B with your drug plan. That was that first example that we showed with the quadruple bypass. Okay, we're going to factor in a Medicare supplement at this point. So this is how this plan would work. A, B, your Medicare supplement plan along with your Part D drug plan. Okay? So these are often called Medigap plans, Medicare supplement plans, Med-Sup plans, so many different names for these things, but it's all one plan. Okay? Now there are, these are going to be administered by private insurance companies. Okay? You name them, they got it. It consists of 13 standardized plans. The most popular is going to be G and N. If you guys have a supplement plan, and some of you guys may have what they call an F plan, okay? The F plan is going away, okay? So if you don't qualify for an F plan before December 31st, you're not going to be eligible to get an F plan, which leaves us with the G plan. The N plan is probably going to be the most popular. Okay? So one thing I am going to say about these Medigap plans, there's benefits to them. There's also cons to them. Okay? There's also some defaults to them. Okay? So these Medigap plans, they come with a premium. Okay? Private insurance companies, you got to apply. When you first turn 65, they give you a guaranteed issue window. Basically what that means is, doesn't matter what your health care looks like. Doesn't matter. There's no health questions. You're automatically qualified to get one of these plans. Okay, so it's a guaranteed issue. They do come with a premium. Okay? The premium is good because you know what you're paying every month. Okay? You know exactly what you're paying every month. It's like balanced bill pay. These premiums also go up periodically. Okay? The premiums go up. So if you have a supplement plan, this is typically the time of the year you want to take a look at it. Okay? You just want to review it. I'm not telling you to change. I'm telling you to review it. Okay? Because once you get it during that guarantee issue, there's no health questions. But you want to review it if your health is in good condition and you feel like you can pass the underwriting. After you're age 65, you need to pass underwriting. Okay? And the reason why you want to review it is because the price increases. You may be able to get competitive pricing by just doing a review. Now, it's going to be subject to your health conditions. But there are many plans out there. Some of them are pretty flexible. So if you have a supplement plan, you definitely want to just review it. Okay, just to kind of make sure that you are still in competitive pricing. Make sure that you can take a look at the trend, if it's going to go up in the next couple of years. Just kind of do a quick review. Make sure that you're still on the plan that's going to be working for you. Okay? There's a lot of speculation of the Plan F. Plan F, it's going away, prices are going up, blah, blah, blah. I'm here to tell you that we don't know. I can't tell you for sure that Plan F premiums are going to go up. I can't tell you that for sure, because I don't know. They may level out, they may go down, they may go up. Typically, they're gonna go up. Okay? Typically, they're gonna go up. But I can't tell you that for sure. So, if you run into somebody saying, oh, you got a plan F, you got to change, the premiums are going to go up, nobody can tell you that for sure until it happens.
What is that? What is it, what would it pay for?
Their premiums.
No, what is that? What does it pay for?
So the F is actually, right now, it covers pretty much everything. The only thing it won't cover would be the only thing, difference between the G and the F is the deductible, $185 deductible, but it's going to take care of the ambulance services. It's going to take care of your doctor services. So when you go into the doctor's office, you don't have a copay. You're already paying a premium for your supplement. If you happen to get into an ambulance, if you have an F plan, it covers that. If you spend time in the hospital, it's going to cover that. There's no copayments. It's going to pick it up. As long as Medicare is picking up that 80%, this F plan will cover everything. The G plan, I'll talk about the G plan since the F plan is going away. It's going to cover everything just like the F plan. The only difference is a $185 deductible. The G plan, you have to pay your $185 deductible. And then it covers everything else, as long as Medicare covers the 80%. The reason why F, G, and N are popular plans is because they cover excess charges. Okay? Excess charges, these are not, the example that I'm going to give you is not going to be exact numbers, okay? But I'm going to exaggerate the numbers a little bit just so that we kind of get the point, okay? So if you happen to break your arm, okay, and you want to see this specific doctor. And this doctor is the best doctor of fixing arms, making sure that it's straight when they put you in the cast and all this other good stuff. He considers himself the best doctor. He's going to charge more than what Medicare says that it's valued at. But because he's a specialist and he feels like he's the best, he's going to put in an excess charge, okay? Now the excess charge, I believe, is only up to 15%, okay? But in this example, I'm just going to say, let's just say casting your arm is $500. He's going to charge $1,000. Those are not real numbers, because I believe it's only 15%, but I'm just using this for an example. So your Medicare will pick up 80% of the $500. The F plan or the G plan will pick up the balance of the $500. Everything above that $500 is what they call excess charge. Okay? That excess charge, your F plan and your G plan and your M plan will pick those up. They'll pick it up. They'll pick up the excess charge, anything that's above and beyond what Medicare will charge. Okay? So that's the excess charge. It creates this balanced budget. You know what you're going to pay every month when you get into these supplement plans. So what I'm going to do is I'm going to just show you a quick example. So Part A, 64-year-old man, $0 because he's worked his 40 quarters. Part B is $135.50, okay? Your Part D is $38, and your G plan is $150, okay? Now these are not fixed costs. It's going to range by area, by plan, by carrier. These are just examples here, okay? So if you set up your plan just like this, your total monthly cost is $323.50. That's your monthly cost. The only cost that you'd be subject to, aside from this $323.50, would be your deductible of $185. Okay? But you know what you're paying every month, $323.50. Okay? So I'm going to go back to this particular example. The person that spent 150 days in the hospital, quadruple bypass, and we're going to go through the same example. 150 days, $93,000. Your cost, $0. because you have that supplement plan. Part B, the physician services, the surgical procedure, $400,000. Your cost? $0. Now you have to pay your deductible, it's $185, okay? And then you have your Plan G, which is $150 per month. Your total out-of-pocket cost during this particular situation, $335. You can really see the difference by protecting yourself with a supplement plan, okay? Again, $335 compared to $173,000. Same situation, this is how you protect yourself, okay?
But you'd be paying the $150 every month while you're in the hospital for 150 days.
Yes.
So it's more than $335.
Yeah, you would add, if you factor in those 2 extra months, it's an extra $300. The example here is just saying, hey, that particular month, that's what you would pay. Because those other months that you're in the hospital is probably coming out of your Social Security or your bank draft, however you have it set up. So for this particular month, it would only really be $335 when you get out of the hospital. There's no big bill waiting for you.
What did F pay for? If you-
So if you have the F plan, you see that $185, it would pick that up.
What does F cost?
Again, that's going to be a little bit more specific, more than what I can just kind of say at this particular event.
Average?
Average, probably you're looking at like $170 for a male per month. Yes, it's a monthly charge when you pick up these supplement plans. Just like this G plan, that $150 is a monthly charge. Yes, ma'am.
But if you got 150 there, why don't you also figure in the monthly charges for the Part B? I mean, that's just a charge that's.
Yes, you can definitely factor that in as well.
Saying that you're only paying 185 more than normal.
Yes, ma'am. You can definitely factor in the $135 as well. That's typically coming straight out of your Social Security. This is above and beyond of what that Medicare is. Because remember, you got to have Medicare, right? That Medicare is kind of one of those fixed charges. This is above and beyond, like the deductible. You wouldn't pay the deductible until you get into the hospital. That Plan G is something that you picked up in addition to your Medicare. So yes, you would be paying your $135 regardless. Okay? Great question, though. Thank you.
Are those two charges, do you send a check in, or can they charge your checking account?
So your monthly costs, if you go with a supplement plan, typically they're going to ask for banking information, and then it just comes out EFT monthly charge. Okay? The $185 is typically a bill because you don't know when that's coming, right? That's a deductible. So when you actually go in to the hospital and they say, hey, you haven't paid your deductible, here's that bill, that's where that would come out. Great question. Thank you. Okay, so I'm going to talk about the third way to set up your Medicare. This is your Part C. Okay? So before I get started kind of running through this, right now, October 1st is what they call the AEP season. Right now, you're able to take a look at the new plans in 2020. Okay? If you have a Part C plan, definitely want to take a look at it, go through your review. There is a lot of expansion going on. Okay? There's a lot of expansion, there's a lot of new plans out there and stuff like that. You just want to take a look at what's in the market right now and compare it to what you already have. Okay? There's a lot of things going on, so I'm pretty excited about this particular piece as well. Now, one's not better than the other. Okay? The supplement is not better than the Advantage plan. The Advantage plan is not better than the supplement plan. How you determine that is you. All this stuff is tailored to you and your situation. Okay? There's benefits and then there's cons on both sides. Okay? So your Part C plans, again, administered by private insurance companies. Okay? So there's many, many plans to choose from. Again, right now there's a whole lot of expansion going on. Okay? These are commonly known as Advantage plans, MAPD plans, or Part C plans. They all mean the same thing. It's the same thing. Medicare just kind of puts all these different names on the same thing. But those three names, Part C, MAPD, Medicare Advantage, all the same plan. Okay? Now, you don't lose original Medicare when you get one of these plans. Okay? You have to have A and B when you get a Medicare Advantage plan. Okay? However, the Part C plan takes over. You still got to pay your $135.50 per month. Okay? But your Part C plan is going to take over. It's going to administer, it's going to coordinate. It's typically going to give you a network to work with. It's going to manage your dollars. Okay? Now, these plans typically include Part D, which is your drug plan, so you don't need that extra $38. Okay? Now, these are going to have that network restrictions. Everybody's heard of HMOs, PPOs, stuff like that? Okay? That's typically what they're talking about when they're talking about these Medicare Advantage plans. Okay? So you want to stay within network. You want to make sure you're going to the doctors, or if you have a doctor, you want to make sure that they're in network, whatever the case is. Okay? But you have to keep A and B. If you lose your Part B, that $135, you're going to lose this plan. You automatically get bumped off of this plan. Okay? Many plans to choose from. Now, these plans typically have a lot of extra benefits. What is extra benefits? Extra benefits are going to be like health club gyms, right? The silver sneakers, silver and fit. They also have transportation. So if you need to go to inpatient surgery or in and out type service where you're not going to be able to see, you can jump in one of their vehicles. They'll take you to and from. They even have over-the-counter benefits to get some of your vitamins and some of the other stuff that you can get at the pharmacies. Okay, like your Tylenol and different things like that as well. They also include some food services. Some plans cover much, much more than that. Okay? But they do have a lot of benefits, added benefits to these particular plans. Now, these plans typically have a low or no monthly premium. So, like the supplement plan where it has $150, in that particular example, $150 a month, these plans may have a no monthly premium. Now, you might be asking me, Eduardo, how good are these plans if you're paying zero? Yes, you are paying zero. However, Medicare knows how much they spend on folks on Medicare. So Medicare will pay these plans to make sure that they manage your health. Okay? I'm going to give you another benefit of being on one of these plans. Okay? It's called Managed Health. What is Managed Health? Managed Health means that your primary care doctor needs to give you a referral. Now, I know you're like, oh, I need one of these referrals. Yes, you need a referral. I'm going to tell you why it's a benefit. Your primary care doctor is going to know what's going on with you. So when he sends you to your specialist has to report back. Okay? So if your specialist gives you a prescription that conflicts with one of the prescriptions you're already taking, your primary care doctor is going to say, don't take that. Let's get something else. Okay? If you take two prescriptions that are kind of not really working together, it could really harm you, right? You want your doctor to understand and know that. If you're on a supplement plan, you don't need a referral. However, you don't get that coordinated care. You need to report back to your primary care doctor, say, I went to the specialist, this is what he gave me, these are the symptoms, this is what's going on. Okay? In these plans, the primary care doctor has to administer all the benefits. They manage the entire deal. Okay? So these are pretty rich plans. Okay? Especially when you're talking about the added benefits. Yes, you have to stay within network. That's how they manage the dollars. Okay? They manage the dollars with the specialists. They have contracts with the specialists. So when you go to the specialist, they can manage all the dollars that they're getting from CMS, from Medicare. okay? They manage those dollars to make sure you get good, solid care, to make sure you keep up with your preventative care, to make sure that you get the care that you need, to make sure that you get the extra stuff like keeping healthy in the gyms, or make sure you're taking the right medications with all your specialists, okay? Ancillary products, okay? These are very, very important. Again, I'll go to my mom. She had breast cancer back in 2009. I helped her as much as I can. But let me tell you, at the end of the day, she still went bankrupt. She lost her home. And I almost went down with her. Because obviously she's my mom. I'm trying to dish out as much as I can, right? Went bankrupt. So these plans, typically the reason why I put $20,000 face value, okay, is because if you're on a Part C plan, there's going to be what they call max out-of-pockets, okay? The max out-of-pockets typically, range anywhere from, $3,500 to $10,000. This will cover you 2 years of your max out-of-pocket. That's the reason why I put $20,000. You can go up, you can go down, okay? But if you are covered, you don't have to worry about those extra expenses, okay? Now, if you ever had cancer, or you know somebody that has had cancer, let me tell you, the prescriptions aren't cheap either. You got to take those prescriptions home. Some people don't realize the added costs outside of the medical attention that you're getting, okay? Same thing with the heart attack and stroke plans. Typically, I put $50,000 on there, and the reason why I put that on there is because those plans are fairly cost effective. They're pretty cheap. And when you think about heart attacks and strokes, what happens? They get disabled. Sometimes you need a doorway. Sometimes you need railings in the restrooms. Sometimes you need a new tub, maybe a walk-in tub. Maybe you need some railings in the tub area. Those are all costs. That's all costs that's coming out of your pocket. Maybe you need a ramp. Okay? There's a lot of extra costs that's associated that's not built into your medical stuff. Okay? So these ancillary products are definitely very, very important. Hospital indemnity. This is typically one of your biggest co-pays on the Advantage plans. Okay? There's an inpatient hospital stay. These are typically your biggest co-pays. $300 is kind of an average. But let me tell you, when you go into the hospital and you have these, 5 days of $300 and you have to walk out with a $1,500 co-payment, it's nice that you already have it covered. It's nice that you already have it covered. So that hospital indemnity is going to help you with your biggest co-payment on those Part C plans. Okay? Now, what about a supplement plan? If you have a supplement plan, is the hospital indemnity needed? It's not needed, but it sure does help. Because again, some of those extra costs. Maybe you have folks that want to come see you out of town. They're going to stay at your house or a hotel close to the hospital. So these costs are definitely very, very helpful. Okay? These are the most popular. Again, the cancer is obviously near and dear to my heart. So is the heart attack and stroke, because it does help with a lot of the extra stuff that is needed that people don't even think about when you go through a heart attack or stroke. Yes, the hospital stuff will be covered through your plans, but what about the stuff at home? Okay?
Is that part of Medicare Advantage? Is that part of C? Is that part of?
No, those are what they call ancillary. Those are add-ons. Okay? Cancer, you can do an add-on cancer, you can do an add-on heart attack and stroke, or critical illness is what they call it, or you can do a hospital indemnity. Those are just add-ons. Because on your Part C plans, your hospital stay, that's going to be your biggest co-payment. And if you end up in the hospital, typically you're going to walk out with, anywhere from $300 to $2,500 co-payment on your Part C plan. Okay? Great question, though. Now, a little bit about Trusted Senior Specialists. They've been in business for over 16 years. Okay? Mr. Michael and Melinda started this business, and they found that there was definitely a need for seniors. They've been part of the Better Business Bureau, the BBB. They've won the distinction 2011, 12, and 13. They've also won the Pinnacle Award winner, and that's just because we really care about you guys. We care about the community. We want to make sure that we simplify the information as much as we possibly can so that you can get as much value as you possibly can get out of this stuff. And really take into account what Medicare really means to you. Okay? That's why they started this thing. Okay? They do have over 5,000 agents across. We also have a call center right here in Houston. Okay? So when you call us, it's not going to go to California, New York. You're talking to a Texas-based company. Okay? We're here to serve you, and that's what we do here. Okay? Now, there is a survey, basically a one-question survey on your on the tables there. Okay? I need that for two reasons. Okay? Number one, CMS says that we need to keep record for the folks that attend any presentation that we do. Okay? So just jot down your information there. There's a question on there. Would you like us to contact you to go through a personalized review? We'll review your Medicare supplement plan. We're not trying to sell you. We just want to review it. We'll help you go through the review and what it means to you. If you have a Medicare Advantage plan, we're going to review it. Let you know what the changes are that if you're on a current plan, what are the changes for next year? All the plans will change. Their benefits change every year. We need to review it. That's the reason why they send you that big old thick annual notice of change. Anybody got that yet? No? Okay. Annual notice of change. It's a thick book. They expect you to read it and know what's in it. Again, I feel like you need a doctorate's degree to understand half the stuff that's in there, but that's what we do. We're gonna review it for you, let you know what's going on. You kind of give us an idea of what you need, what your wants, what your wish lists are, and we're gonna coordinate that. We're gonna say, hey, this is what's going on. This is where it's at. These are some of the needs and wants that you have. These are the plans that have it.